Okay, so I'm Dr. Walker, and I want to talk a little bit about menopause. Um, Lately, it's been a topic, you hear it a lot because now women are speaking out about it. I have it, I had the peri, the everything full blown, whatever you want to call it. I am experiencing that, and it is horrible. Today is one of the days. My body is okay, but my mood. But anyway, you can see it on, it's written on my face. So a couple of months ago, I went to a conference with Dr. Sharon Malone, and they had Holly Berry on video and a couple other people. But I went to the conference because I was like, I need to know, please, like, I need some remedies, I need some relief. And so uh, they gave out this book. She talked about a lot of female issues and concerns. So, this page talks particularly about menopause. It's hot in here. So, let me read you some of the symptoms, and I'm going to let you know which ones I'm experiencing. So, it says, what can I expect? Let's see. Allergies. Last week, I was sneezing and sneezing and sneezing, and the people at work were like, "Are you okay?" And I'm like, I never had allergies in my life. I have terrible sinuses, but just sneezing, 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 like, I was just like, what is going on? Okay, and it's winter. It's wintertime. Allergies in the winter. Okay, anxiety, that's all the time. That's all the time. Bloating, this little pouch right here. So I'm on a mission. I'm actually losing weight, but you know what? This pouch has not moved. Bloating all the time, and then it feels very uncomfortable. Like you gotta. It's like I have gas, but I can't get it out, and yeah, all that. Okay, brain fog. We with age and all of that, it's like I could be doing something 1 minute, and of course, then the next minute I'm like, what was I doing? I have no idea. Breast tenderness and changes in size and shape. Definitely breast tenderness. Mine have now gone from C to D, right? Just like that. I didn't even know that that could happen, right? But of course, I had to get new bras and all of that. And then I'm just like, why? How do you, how does your breast grow like in your 50s? How does that happen? Like, okay, but it did. And burning dry mouth syndrome. I don't know what that is, but constant dry mouth for me. I don't even know. Okay, depression, that's like anxiety. Okay, everything. It's like, oh, everything, all the time. Digestive issues. So I have the, what is it called? I have the ischemic colitis. How did I get that? Was my question. I have been a vegetarian for 35 years. Did you hear what I said? 35 years I've been a vegetarian. What is wrong with my digestive all of a sudden? Went to the hospital last year. I was hospitalized. Ischemic colitis. Where'd that come from? Menopause did it to me. Okay. Electric shock sensations. I don't even know what that is. Thank God. I hope I don't get that. I don't even know what that is. Thank God I don't have it. Dizziness all the time for no apparent reason. Nausea, dizziness, all that. When I got my operations and they give you a little Percocet, I couldn't even take them because took one and I felt like I was like nauseous and dizzy, like so intense. And I was like, no, I'm not. I can't take that. I can't even enjoy, like, okay, get rid of the pain. And it couldn't take, it was terrible, terrible. Okay, fatigue, feeling of dread, fatigue all the time. Um, then there's something called formication. And I kept wondering, like at night, I'm itching all the time. Something's itching me. Something itching me, right? Just for no good reason. Itching. itching. All night. I get comfortable, I fall asleep, and something's itching. Okay, that's what that is. Okay, then. Hair changes. We're not going to talk about the hair. Y'all seen my whole ponytail in the sink, right? I can't even right now. What? Look at this. This is like a puff. This is a little puff. I used to have a ponytail. Yeah, we're not even going to go there, okay? No, we're not going to do that with the hair because we already know. Now, I have found some stuff. It's thicker, right? It's getting thicker, right? It's just not growing like out, like long or whatever. Like, how you supposed to have a pony's tail? No, I have a little bunny's tail. There we go. Okay. Headache and migraines. I had that before. Now they're just more intense, right? Because of the sinuses and everything. Okay. Hot flashes. We already know about those. Irregular heartbeat. I had that before, so now it's intensified. Irregular menstrual cycle. So, yeah, you stop and then 9 months later you get one. What is that? Really? Oh, okay. Irritability. We don't need to talk about that. Okay. Just like anxiety, depression, irritability come with it. Okay. You ask me something, I got to catch myself because I'm like, yeah, okay. The itchy skin, just talked about that. Okay, joint pain. I have fibromyalgia. I have nerve damage. I have sciatic pain. And so then on top of that, joint pain. Like today for the pain, it's a good day. I just had a surgery, the neurostimulation. They gave me the injections. All of that is working. Thank the God. Okay. Libido changes higher or lower? Absolutely. Okay, mood swings, we talked about that. Muscle aches, same thing, talked about that. Night sweats, talked about that. Panic attacks. What does this say? Okay, the paresthesia. All the time, all the time. And not only, I have akathisia, so I have the RLS, the restless leg syndrome. So I can't sleep in a bed because of the pain. So I can't lay my body down. So I sleep in a chair, like in a rocking chair. Last night I actually slept in a bed because the pain was good. It was all right, right? Most times I sleep in a chair. When that RLS come, baby, my leg, all night. All night. It could be 3 hours later and my legs is still every few minutes. That's why I don't sleep. I can't sleep. Okay? Then we have sleep changes. Well, there it is. Okay. Vaginal dryness. There it is. Weakened fingernails. We talked about that. I have to put on these press-ons because my nails are down to the nub. Okay. Just like my hair, my nails grew long and nice. And so whenever I would get them done, they'd be like, oh, your nails so nice. They're mine. Like, yeah, so nice. They down to the nub now. Down to the nub. Weight gain and wrinkles. Thank you very much for that. Okay, wrinkles all over. And then you put the cream. I do have some cream that works a little bit, right? But it's still worth it. And then we talked about the weight gain. Okay, so let's see what remedies she's got. Whew, baby. So, okay. I just lost the page. Did I lose the page? I sure did. Oh man, where did I gotta find a page. I don't just want to give you the negatives. Okay, so the what she says, right? The progestin pills, right? Go get you some. And the hormone releasing IUDs, go get you some. A low dose of antidepressants, okay? I don't know what this is. I can't say that. What is the running ADA medication? So it's a medication, it's called Veozah, VEOZAH. She says that is for hot flashes and they help. Okay. She also says, okay. She says, make sure you work on your diet. Okay. Make sure you exercise. She says, smoking makes it worse. Anybody smoking? Okay, we'll intensify it. And then she says hormone therapy. I'm on that as well. They give you, it's a patch. It does work. It works some. And let's see. She gives some other. Okay. She gives some other recommendations. What? Okay. She says you need a calcium rich diet and you need a vitamin D rich diet. Okay. Excellent, excellent. And a couple of other things. Let's see. Where is it at? Where is it at? Let's see if there's any more. We told that. Oh, okay. So she also says know your bone density, right? She said get a baseline DEXA scan, right? As soon as you're menopausal, you get that, right? And talk to your doctor about that because having a fracture or something like that, very important. She also mentions finding out if you're lactose intolerant. Okay. And then the last thing she says is vaginal estrogen. Right. So she gives you what you might be experiencing, and then she gives you some remedies for that. So let me see if there's anything else. I think that is it. If I find anything else, I will definitely let you guys know. Because if you're like me, you definitely need some help. All right.